Good afternoon, Dr. Sharma. It is so good to see you again. Greetings from North Carolina and happy Easter.
Well, greetings everyone and to yourself from Guyana, and happy Easter to you all and everybody out there. In this trial time, we remember the sacrifice of the great Lord. So it's very good day for us. It's a reflect time for reflection.
Amen. Thank you so much, Dr. Sharma. And as we are dealing, today's April 10th, 2020, as we are dealing with this COVID-19 coronavirus pandemic, many people around the world are reacting in different ways, especially from an emotional point of view. As a mental health expert, I would like you, if possible, to please address specifically from a behavioral standpoint, what are some negative personality traits?
Thank you, Mark. So we are seeing also at this time behavioral problems. But I wanted to touch also on the fact that there are many positive behaviors that are that are in evidence, and that's a very good thing to see that the crisis is bringing out the good in people, altruistic tendencies, caring, support, sharing, the kindness that human beings should have. On the other side, we do see negative behaviors, and it's because in all of us we got these traits that are balanced. Negatives with the positives. The positive trait of caring would be balanced out by lack of care. So, trust versus mistrust. So we have it. We do have passivity in us or natural tendency to be aggressive in some people, might be more. So there's a balance between these traits, and some people actually have one set of traits dominate them, and it makes up a type of personality. We all have these traits, so we don't like to know that we're aggressive, maybe, but we do have it because it's protective. We have to have some ability in ourselves to be able to respond to danger. And so we do have them. And we inherit these traits. So there may be a tendency in the family to have more caring traits. And you see that passed down to their kids, the child takes after the mom in her caring and supportive and altruistic behavior. So we share traits coming through our genes, and it's an inheritance thing.
Absolutely, absolutely. One of the facts, Doc, is that speaking of traits and speaking of the impact others can have on us, our environment, for example, someone might have the issue of alcoholism in their family, and yet you can have a parent who is very abusive. You can have a parent who, when they're under the influence of this alcohol, that it impacts the household.
Yeah.
However, you can have one child who might embrace the same pattern, like a father, and be
Yeah.
very have a tendency to drink, and yet you would see another sibling who, because of the fact that they have experienced that, would refuse to touch alcohol.
hmm hmm
What are some of the answers to this kind of outcome within the same household in terms of the
hmm
behavior of some
Yeah. Well, from a genetic point of view, we know that there are what they call epigenetic factors that influence the behavior. And the family behaviors can be, we used to think of them as being the social factors, but now we've clearly known that it's also influencing our genes and the way it's expressed. So that child is being affected by the genes that the child is inherited. So the dad himself may have been inheriting genes that influenced addictive type behaviors. So we all under the influence of our foreparents in how we behave, but we do have the ability to counter it. So one child may not be able to handle the pressures of the addictive drive, versus the other child who totally rejects it and would not even touch alcohol. So we have the capacity, human beings have the capacity to override those genetic influences and the traits. Sometimes we don't think about it or reflect on it. So, for example, what you do today gives us a chance to let people know that reflect on the behaviors that you have. What kind of behaviors you show? What are you doing? Are you showing those caring, supportive type of things we'd expect in a time of crisis? Or are you acting indifferently to your friends? Are you acting out of greed to make the most out of this pandemic and to manipulate and try to get as much as you can for yourself? Are you acting out of frustration? Because some people can't tolerate frustration, their frustration tolerance is low. And that is also within the personality of the person. Some people are able to have a very calm, tolerant, patient attitude to crises. But others we've seen at home getting on very aggressively with their partners and their children because they can't handle their frustration. So it is the personality of the individual. I saw some people behaving very rudely to persons who were trying to get some items from a supermarket and it was closing time. And they said the time for closure was 5. And I guess the people were a few minutes late. But the way they were being addressed was very kindness that we're seeing in that kind of interaction. And it means that the person who is doing that behavior is not feeling for what those individuals are going through. They may be depriving a child of some water, or some necessary food just for a few minutes, not keeping their place open, so or following the rules so rigidly that you hurt other people. So it's a lack of empathy. So we look at this empathy things very seriously because there's a whole school of thinking now about emotional wellness, emotional well-being that points to being emotionally well has to have some of those capacities to share, to be able to understand, and to feel for others, to be able to have empathy. So it's something that is very important in our society because we see people who are bullies in schools. Now they're at home and they may be passing their bullying behavior to other children, but they are also bullies in society, adults who were being bullies in childhood, becoming bullies in the public life, sometimes in holding very high offices. And these are people who can influence a community, a whole country in a very negative way if they're sitting in charge. So it got to be very authority, and there must be systems to address how to deal with them. There should be avenues of complaints or be able to make that change because it's not healthy for others to experience that kind of behavior
Yes, Doc.
that I'm talking
Very good
about.
observation.
The bullyism that you see.
Yes, Doc. With regard to specific steps, for example, if someone knows that within their family, within themselves, they have a propensity to act certain ways, especially under certain circumstances, they have a predisposition to become angry at certain incidents. What would be some specific steps that you would say they can just one or two things they can do, knowing how they might react? What can they do to be intentional about not having a negative outcome through their actions?
Good question. One, the first thing is, of course, for the person to recognize that they do have problems in their personality. We are unfortunately now able to do that most of the time because we are protected by what we call our defenses that we put up. So we don't want to know our negative traits. We hear it from others, but we brush it off. There's a sense of denial in all of us about negative traits. negative behaviors. So for an individual to make that change in their personality, it's a very tough job, especially if they develop or they have what we call personality disorder. They're extremely difficult to treat. Some of the best strategies for treating after if the person seeks out help or they know it's impacting their family and the family gets them into some kind of help situation for change is the willingness to make the change. And that's like the biggest thing. To get them to that point, the willingness to make the change is almost the battle won. The next steps are not so tough. We can go through programs like the emotional well-being, the make the change programs and in group therapy that happens sometime and individual therapy and sometimes with some necessity for medication change or for assistance with anger control and so on. But there's a lot of help out there. There's anger management programs, there's cognitive behavior therapy changes that are pretty powerful. That's a real great therapy that's available. There's supportive therapy through pastoral counseling that you would do, and so there's many avenues of support. But coming back to my original point, Mark, it's really about accepting that there is a problem within myself. How to get to that point is not easy because of this barrier that is put up by individuals, a denial to one's personality defects. So we look in the mirror and we see a nice face, but we don't see the behaviors attached to the face. And often people around that individual may not even tell them because they're afraid of repercussions. So if the person has a very overbearing tendency and dominating personality and puts down everybody around them, who's going to stand up to that individual and say, well, I think you need to get your act together, behave a little more decently, stop this abusive behavior, and don't try to control everything around you. Those are very difficult personalities, the controlling type, the ones who must see everybody, obey them, follow their rules. They are in charge, they know everything, the narcissistic traits are very dominant. They're really very hard. You see them in leadership positions and they affect the whole country, for example, and it's not nice to see that happen. And again, it's very hard to change it because how do you step in and tell somebody, I don't think you're very well, sir, that, oh, you're coughing and you have these symptoms, you need to step out and get some treatment. But how do you tell somebody when the behavior is abnormal that, look, I think you should step out and get some help, they would most likely say no. But I also want to touch on some of the other traits that affect people. You see, the thing about the personality traits that are negative, the disorders that people have that impact others, is a problem is that it impacts others. It doesn't impact the person who has it. They're not really aware of what they're doing, that they're doing something that is bad, but it impacts others, they affect others. If they're driving, for example, somebody with obsessive compulsive personality, perfectionist traits, they want everything to be perfect in their homes and their household and their lives and their workplace. They can be very distressing to manage, to deal with because the children of these people tend to be under stress, that they want to please the parent, they want to be absolutely perfect, but nobody is absolutely perfect. So they make a mistake, the parent comes down on them, cut down the bricks, So there are different types. So that's one that's very hard, the obsessive persons. The other one that I want to talk about, I see a lot in persons who work in business places. They may have passive aggressive traits. So they're not happy about their job and they take it out on their customers. So the customers come into that place, they don't know that worker is unhappy with their boss and they get this very sulky, disinterested attitude and they end up feeling like they're being neglected or mistreated. And it's not coming directly from an interaction between the two persons, it's coming because of the worker having the inability to express assertive feelings to their boss and taking it out in a passive, we call that the passive aggressive behaviors on the customers, and the business gets hurt by that type of attitude. So many others, but those are a couple of examples I thought you might find interesting.
Absolutely, indeed, Dr. Sharma. And based on what you're saying, is that the actions of some individuals will be noticed by others, and it is the pretty much the individuals around the person who's acting in a manner that's impacting others in a negative way. It's important for those individuals to bring it to the attention of the person, and so that way there can be some kind of acknowledgement on behalf of that person, which is the first step, one of the steps that you mentioned, and then the willingness of the person to recognize and seek help, hopefully from a
Yes.
professional. And so someone like yourself who specialize, who has all the certifications from a mental health perspective, or whether it's within pastoral settings where someone can be guided to know that there is help. And
Yeah.
so it is so important to remind people that there is help, and you need to seek that help. And it begins by acknowledging that we do have a problem, and mental
Yes.
health is a serious problem that is getting more and more attention. And correctly, as many doctors like yourself have been helping people from a mental health perspective.
Absolute, Mark. And the thing is, if you look at it, if if somebody is listening to the other's criticism or not taking it in a negative way, but say, well, what is behind those words when they said to me that you're a very uncaring, insensitive person? What is behind those words? Does it ring true? That would be a big start. If people can start reflecting on their own behaviors and say, was that correct for me to behave that way? But it's a very hard task for us to try to bring that to people, because usually people get very offended when you point out a behavior, and very often the behavior is pointed out by somebody who gets hurt. They may just tell the person off and say, you were very rude to me and you shouldn't be doing this. And then the end, there's an exchange, an angry exchange, rather than something that could be helpful for both parties. If we can work this thing out, I think those are the things that we got to look at in the future. So, what strategies are there to help break down the relationship difficulties? And it's true communication. It's true communication. The fighting and physical interaction is not working. We got to do it through healthy communication, true respect, mutual respect, respect for other people, getting people to gain that empathy that is so critical to understanding how somebody else is feeling. So if we can, one of the messages I want to leave is that if we can start thinking about what's the other person's point of view when they act or behave that certain way that I got upset, what were they thinking about? Can I understand where they're coming from? So if I can understand their behavior, I become more tolerant and become more understanding. I can now be less angry when that behavior manifests, and I'm able to respond in a much more patient, more calm, more caring fashion. So we got to help each other. We got to know that there are many people with problematic personality traits. It's not their fault. It's somehow inherited through the genes. It may be manifested more because of the way the family operates with the child as they were growing up. And a lot of these traits become predominant because of life experiences. Somebody was always hurt in relationships, they end up very suspicious about future relationships because they don't trust anymore. So that distrusting type of behavior becomes predominant in their personality.
Well, it's such an important point that you made, because I think it's fair to say that even if we think about traits that God designed us in a way to want to have a relationship with us. And as a consequence, we want to have relationships, and especially during
Absolutely.
this pandemic. We find that, as you had mentioned in the previous segment, that is not so much, is more physical distancing and more than anything else, but we can still connect with others. And this is a way to connect. And so it's so important to have that relationship and to seek help, as you mentioned. And I would like to thank you for this segment. We look forward to another segment. Hopefully this will all be building on the curriculum for Through Victory. And so we just thank you, Dr. Sharma, for your contribution in Guyana and to many people around the world. And we're thankful that you're able to help so many of us. And mental health is a serious problem. And however, it can be dealt with in a very objective manner and a realistic manner. And there are practical steps to offer people. So thank you. And I'll leave you with it for some final words.
Thank you, Mark, and you have a great Easter.
Thank you, Doc. Happy Easter. God bless you. Bye-bye.
Bye. Bye.